Hello everyone, a very good morning. Today let's discuss on our very short topic and very important for undergraduate, postgraduate and all your competitive exam. You might get a question from this topic, that is your Ophthalmia Neonatorum. Okay, I have taken this particular topic both from our Nelson and also from our IAP article. Yes, going on with the definition. What is the definition of your ophthalmia neonatorum? So, child getting any conjunctivitis or ophthalmitis which is occurring within first 28 days of life is called as ophthalmia neonatorum. So, which is occurring within first 28 days of life. Okay, it is called your ophthalmia neonatorum. What is the incidence of your ophthalmia neonatorum in India? In India, the prevalence is between 0.5 to 33%. Okay, yes. Next, going on to the etiology, what are the causes? You have bacterial cause, chemical cause and also the viral cause. Among bacteria, you have sexually transmitted disease and non-sexually transmitted organism. So, you have sexually transmitted. Another one is non-sexually transmitted one. Okay, right. So from sexually transmitted, what are the organism you have here? So the organism in this are, first one is your chlamydia trachomatis. Second one is your Neisseria gonorrhea. Okay. Among non-sexually transmitted, you have your pathogenic bacteria, that is your Staph aureus. Second one is your streptococcal organisms. Third is your H. influenza. Fourth is your Pseudomonas. Okay. These are the main non-sexually transmitted organism which can cause your conjunctivitis in children less than 28 days of life. Among chemical, it is your 1% silver nitrate which has been used as a prophylaxis, can cause your chemical conjunctivitis. Yes. Next, coming to viral causes, which is very rare cause. Viral causes are very rare cause. One is your adenovirus. Second will be your herpes simplex. Third one is your enterovirus. These are the most common virus that can cause ophthalmia neonatorum in the child. Okay. What are the specific signs and symptoms pertaining to the particular bacteria or virus or your chemical installation? So important points we can talk here. So first, in chlamydia trachomatis, which is the most common, this is the most common cause of late onset conjunctivitis. So it is the most common cause of late onset conjunctivitis, right? Yes. What is the time period? So, or time of appearance of the symptoms of your ophthalmitis. So, if the child is having a chlamydia trachomatis infection, the time of appearance will be 5 to 14 days. Since it is the most common cause of late onset conjunctivitis, time of appearance of your conjunctivitis or your symptoms will be 5 to 14 days after the birth. Okay. And what are the important points regarding your chlamydia trachomatis? The child can have a mucopurulent discharge. So the child will present with a mucopurulent discharge to severe eyelid edema. Right? Yes. And child can also have a pseudomembrane formation. This pseudomembrane formation is not pathognomic for your chlamydia trachomatis. This pseudomembrane formation can also occur in your viral conjunctivitis also. Okay, viral conjunctivitis and also in your bacterial, this streptococci, staphylococci. In such conjunctivitis also the child can have a pseudomembrane formation. Yes. What is the treatment for your chlamydia? Treatment for your chlamydia is azithromycin. You have to give azithromycin at the dose of 20 mg per kg for 3 days, which is a single dose. Right? Yes, this is regarding your chlamydia trachomatis. Another one thing is, how do you diagnose this? Diagnosis. Diagnosis is by taking the epithelial cells. Taking your scraping the from the tarsal side of your conjunctiva. You have to take the sample from the tarsal side of conjunctiva. Then after that you do a Giemsa stain, in which you can see a intracytoplasmic inclusion, which is specific for your chlamydia trachomatis. So one is here. This one you will be learning it in your microbiology, right? Giemsa stain epithelial cells, where you can see a intracytoplasmic inclusions, right? Yes, this is regarding your chlamydia trachomatis. Next is your Neisseria gonorrhea, that is your gonococcal ophthalmitis. So this gonococcal ophthalmitis or gonococcal ophthalmia, time of occurrence will be between 2 to 5 days after birth, right? Yes, and this is a most virulent infectious, this is the most common virulent infectious one, in which the child can lose their sight, so which can lead to the blindness. Here also there will be a mucopurulent discharge, and there will be severe edema, eyelid edema will be present, and your corneal ulceration. This corneal ulceration will be very severe, that it can lead to a blindness of the child. So what is the treatment of your this gonococcal ophthalmia is, you have to give a single dose of ceftriaxone, that is around 50 mg per kg per day. You will be giving at the dose of 50 mg per kg per day. Along with that, you have to give a saline irrigation of the eyes. So saline irrigation of the eyes every 1 to 2 hours should be given. This is regarding your gonococcal ophthalmia. Next is your chemical conjunctivitis. So this is by instilling your prophylactic thing, that is your 1% silver nitrate. So the child can have a red eye with some swelling of the eyelids. It will occur 6 to 8 hours after the installation of your topical prophylaxis. And what is the treatment? You have to withdraw the topical application. So after 48 hours of withdrawing your topical application, the child will return to its normal state. Next is regarding your herpes simplex. In herpes simplex, time will be, that is time of appearance of your conjunctivitis will be during first 2 weeks. This is during first 2 weeks. Okay, here the child will have serosanguinous discharge. The child will have a serosanguinous discharge. Dendritic keratitis is pathognomic of this. So dendritic keratitis is a pathognomic feature of your herpes simplex. Herpes simplex causing your ophthalmia neonatorum. So this is a very rare cause causing your ophthalmia neonatum. What is the treatment for your herpes simplex? Treatment is you give IV acyclovir at the dose of 20 mg per kg 3 times a day for about 14 days. If the child is having only your ophthalmia neonatum, then you give only for 14 days. If the child is having disseminated herpes simplex infection, then the duration of treatment will be for around 21 days. Okay. Along with that, you use topical ganciclovir. So topical ganciclovir is being used 0.15% for about 14 days. Okay. This is regarding your herpes simplex ophthalmia neonatum. Next is your pathogenic bacteria, that is your staphylococcus, streptococci, or your Pseudomonas. Pseudomonas is a most virulent organism. Here the child will have a conjunctival redness. And discharge will be present, and the symptoms will appear within 72 hours of birth. Right? Yes. It is the most common cause of conjunctivitis. The most common cause of late onset conjunctivitis is your chlamydia, and this pathognomic bacteria are the most common cause of your conjunctivitis, right? Yes. Next, what is the treatment for this? So the treatment for your this pathognomic bacteria causing conjunctivitis will be your tobramycin eye drops. Should give tobramycin eye drops at least 4 times a day for 7 days, right? This is the treatment option for this. Next, what is the differential diagnosis for your ophthalmia neonatorum? First one is your dacrocystitis, which is caused by congenital nasolacrimal duct obstruction. So dacrocystitis, which is being caused by congenital nasolacrimal duct obstruction, which is leading to a distension of your lacrimal sac. So dacrocystitis, okay. This dacrocystitis is the differential diagnosis of your ophthalmia neonatorum. Yes, this is regarding your ophthalmia neonatorum. I think this video is helpful for both your university exam and also for your viva session in your university exam. Thank you for your patience listening. Let's please like, share and subscribe our YouTube channel. Thank you.